Rupert, Haida Gwaii, up north to Atlin, and in the northeast, Fort St. John, Fort Nelson, and all the communities in between. Just an amazing and huge and diverse region represented by Northern Health. I'm here in Hazelton, and I'm joined by my co-host in Dawson Creek, Mike Bernier, MLA for East River South. Hi, Mike. And
hey, Doug.
Also, go ahead.
No, well, you finished, sorry.
Well, also with us are special guests, Cathy, Ulrich, President and CEO of Northern Health, and Raina, Fumerton, Medical Health Officer of Northern Health. Many of you I know use the 7 o'clock period, and we're just cheering for our healthcare heroes, the nurses, the doctors, the care aides, those working tirelessly to make sure we stay safe. And in my rural area, I go out in the balcony and I can hear faintly the drums in the distance and the pots, but the drums especially as a sign we're in Gitxsan territories. I also want to give a shout out to the grocery store workers, the pharmacists, the truck drivers, all those working to make sure people in BC get the essential services they need. And especially in our areas, we're such a huge region, and the truck drivers and those who support the truck drivers. I really want to take my hat off to them and the work that they're doing. Some of our remote communities get only deliveries once a week. So that link with the transportation network and the truckers is essential. We also want to recognize and thank those of you watching at home right now. You have been making some pretty big sacrifices in order to help flatten the curve. And the physical distancing is one aspect. I know here locally, it is a sacrifice, for instance, not to be able to use our provincial parks. We know that we want to ensure that we lessen the risk of community transfer. And so that's a temporary measure, but I've heard a lot about that. And so thank you for your sacrifices. I know it's been tough, but as we know in the presentations from Dr. Bonnie Henry, it's been working, and we need to keep it up. We understand there's lots of questions, and that's what this is about, and that's what's next. It's why we're here this evening. Our province was the first jurisdiction in Canada to provide daily updates, and our government has been taking quick action to provide people with the very latest COVID-19 updates. I believe you would like to join me in thanking both Health Minister Adrian Dix and Dr. Bonnie Henry for their service and their just incredible efforts. That said, we want to make sure we're doing all we can to keep people informed, and that's tonight's virtual town hall. It's one of the many ways that we've been doing that, and we've been holding them around the province. I'm going to hand it over to my colleague now, Mike Bernier, MLA Mike Bernier, to give us a quick overview of what this is going to look like. But first, I just want to say, you know, I've known Mike for many years now, back to our local government days, and sometimes in the legislature, when you only see snippets, you might get a distorted view of how we behave towards each other and how we interact. I just want to say with Mike, there's a lot more that joins us than separates us, and tonight is a good example. So I'm really glad you're here, Mike, and now over to you.
Oh, thanks. Thanks, Doug, and appreciate those comments. And it's great to have everybody joining us tonight virtually. You know, these are uncertain times. I know everybody's doing their best to help get through this. I know it's been hard for a lot of people, you know, whether you've lost your job, whether you're in a business that's had to close down. It could be something that's like missing your grandchildren, like me, when you're used to having that physical contact with them all the time and having to step away right now to make sure everybody's staying safe. So I want to thank all of you as well, like Doug did, for everybody taking those extra steps that we're doing right now to make sure we flatten the curve, make sure we're staying safe. It's my pleasure to introduce again Cathy Ulrich, the CEO of Northern Health, and Dr. Raina Fumerton, who's the acting medical health officer for Northern Health. We're just going to quickly maybe give each of you, start with Cathy, a few minutes just to introduce yourselves, give everybody a little bit more information of your roles.
Thanks, Mike. So I'm Cathy Ulrich. And I've lived in Northern BC since 1986. So this has really been my home for some time. And I do love the North. I live in Prince George, and today I'm joining you from Prince George. I just want to take the opportunity to really thank the staff, physicians, nurse practitioners, and managers within Northern Health for an extraordinary amount of work that they've undertaken over this last 6 weeks to 2 months. It's been quite extraordinary, and I do want to take this opportunity to thank them, and thank you for giving us an opportunity to talk live with people.
Dr. Fumerton.
Thank you. Hi, everyone. My name is Dr. Raina Fumerton. I'm the Acting Chief Medical Health Officer for Northern Health, and I also wanted to echo the expressions of thanks and gratitude to all of you for everything you're doing in helping us to achieve what has been a successful flattening of the curve thus far. I am basically in my role, I'm leading out the public health response to the COVID pandemic within Northern Health Authority. And also want to echo my appreciation to all of the Northern Health staff and also our partners at First Nations Health Authority. And I know that the public health teams have been doing a lot of work it's more of a background work, but it's really important work as well. And so just wanted to raise my hands to them and thank them for all that they've done as well.
Good. Well, thank you again, everybody. There were a lot of questions that came in prior to tonight from a lot of people. We did our best to kind of bunch some of those together. We're going to go into those questions right away here with Doug and myself reading out those questions. But I'd also like to mention, if you're watching on Facebook, that you can also ask questions in the comment section below on Facebook. And in a little while, we're going to get to those questions as well and try to be a little bit live, interactive, and try to make sure that we do our best to get as most information as we can out to you tonight. So turn it over to Doug. Let's get going.
Thanks, Mike. I understand there was maybe a couple of technical difficulties at the start as far as audio. So I just wanted to say good evening, Amayuksa, which is good evening in the Gitxsan language. I'm coming to you live from Gitxsan territories, Wilp Nicodane specifically, and in Hazelton. So yeah, lots of questions, and that's what we're here to do. So let's get started. There's first question is from Betty from Taylor. So thank you, Betty, for the question, and it's about testing strategy for Northern Health, and we've been hearing a lot about that. So the actual question is that Dr. Henry says more testing is being done. How come Northern Health is not offering testing to people that are sick and call their number?
Yeah, thanks for that question. I can field that one. As you know, the testing strategy has had to change over time due to the circumstances at the different times and what we've been able to accommodate in terms of surge capacity and capacity at our labs. And so at this point in time, I'm really pleased to be able to say that we have capacity to broaden our testing strategy. That was not the case initially. We had to be very focused in who we tested, and there was good reason for that. Now we have ability to test more broadly. And so any British Columbian who's exhibiting cold, flu, or COVID-like symptoms can be assessed to get a COVID test from a physician or nurse practitioner. Healthcare providers can order a COVID test for any patients based on their clinical judgment at this point in time. So we have COVID-19 testing locations in communities across the north at this point in time. In some cases, a physician or nurse practitioner may decide that a person with symptoms can be managed at home and does not need to be tested. So again, there's some clinical judgment in all of this, but certainly testing is available for those who need it. And of course, not everyone requires a test, but for information about Northern Health and testing, and our collection centers. You can call the Northern Health COVID-19 online clinic and information line, and that number is 1-844-645-7811.
Well, thanks. And kind of along those lines, you answered this a little bit, but we have another question from a resident in Vanderhoof that says, according to the BC COVID dashboard, the average test turnaround time for the North is between 40 and 80 hours, while the rest of BC is only around 20 hours. As subsequent phases appear to require much higher testing frequencies, is there a plan to improve the number and efficiency for testing here in the North?
I can take that one, and Raina may have some additional comments. We have dropped the time significantly. So at the beginning, it was a much longer turnaround time. That now is down, as the writer has said, down to about 20 hours turnaround time. That is partly because there's been increased capacity developed in the labs across the province. But also in the North, we have done a lot of work to decrease the transport time from the time that specimen is taken to getting it down to the labs in Vancouver. And we've now got air transport out of Fort St. John, Terrace, and Prince George, which has really expedited the turnaround time. There is a transport time, though, for tests from the North that is going to mean that it will take a bit longer for the results to come back to the North than it might in other parts of the province. In addition, we are working to add some capacity in the North. So UHMBC started being able to process specimens this week, and we are looking to put similar capacity in place in Fort St. John and Terrace.
Mm-hmm.
Thanks, Cathy. And again, thanks to those working in that transport industry, moving those samples around. Again, part of our essential frontline workers, and thank you to them. We have a couple of questions rolled into one here. People have also been hearing about new types of testing, and there's a question from Patricia from Fort St. John. Thank you, Patricia. Will individuals be able to get testing for antibodies to coronavirus soon? And Matt from Terrace, along the same lines. Thank you, Matt. How will people be tested, and can anyone request it? So there's two.
Yeah, thank you. I can start and provide some answers to those questions. And Cathy, if you have anything to add, please do. So, will people be able to get testing for the coronavirus antibodies soon? There's a lot of active work being done as we speak at the BC Centre for Disease Control, validating antibody or serological studies is the other term you might hear. Serological basically means a blood test, and antibodies are basically a marker of whether or not you have immunity to any specific organism, including COVID. So that is actively being worked on, and there will be some sort of initial pilot studies done to validate that technology. We're probably a couple of months out from being able to offer that more broadly to the general population. And while we wouldn't necessarily need to test every single resident of British Columbia, there will be a strategic method to how serological or blood antibody testing rolls out. And we will be trying to ensure that we have a very representative section of the population, so that we have a good idea in British Columbia and the different parts of British Columbia and the different populations within it, what the exposure and what the immunity is in our population.
Well, thank you. And, as we're doing the tests, this is probably one of the number one things for myself, I'm sure for Doug as well, for people in the North. This question comes from Carly from Dawson Creek. Thanks, Carly. And this is, why is the Northern Health region so big? And because it's so large, why didn't they narrow down the test results? I know they won't say, there's cases in Dawson Creek, but couldn't they have said there's cases in the Northeast or cases in the Northwest, broken down the health region a little bit. And again, this is a very common one. People want to know, why are we not letting people know a bit more information of where the positive results are?
Yeah, thank you. I can take a first stab at that, and then Cathy, please add. But I recognize that across different jurisdictions and even across Canada, different approaches have been taken in this regard. In BC, we've made the decision that we will be reporting, at least at this point in time, where numbers are still relatively low, particularly in some regions, including the north, that we will be reporting the total number of lab confirmed cases at the health authority level only, with the exception of when we need to declare an outbreak, at which point in time you can ascertain what community that is in, because that would be identifiable if it was a long-term care facility, etc. At this point in time, I'm happy to say we have no outbreaks in any of our long-term care facilities. And the other reason we would provide information at a community level would be if there was an event where our public health case and contact follow-up team wasn't able to identify all the necessary people in order to ensure that they are taking the appropriate precautions and have the awareness that they need to have. So a good example of that would be something like the dental conference that occurred in the Lower Mainland. Aside from that, we've made a provincial decision, which I agree with, to keep the case numbers at a health authority level. I can tell you that we do have cases in large and small communities across all of our health service delivery areas. And one of the unintended consequences of providing community level data, particularly in small communities, of which we have many in the north, is that we've seen stigma become an issue in communities where cases have been identified either by individuals or by third parties. So as I said, we do have cases across the entire health authority. For any confirmed case, public health has a very robust system for following up close contacts and the case themselves and supporting them in the actions that they should take. I think it's important that no matter where the cases are, we are all assuming that we have cases in our community, because the cases we know about are one thing. There's also that we don't know what we don't know. So we only know about lab confirmed cases, and we need to assume that cases are circulating in all of our communities. And as such, we would need to be following the public health orders and guidelines that have been outlined by Dr. Henry.
Thanks, Dr. Fumerton. And yeah, you referenced how big and how diverse the Northern Health region is. And I know we had troubles at the start with audio, so I just want to reinforce for people who may not know the actual boundaries. The region goes in the south, just down past Quesnel, and the southeast over to Belmont, in the west to Prince Rupert and Haida Gwaii, in the north up to Atlin, and the northeast up to Fort Nelson. So pretty vast area that's being served by Northern Health. I have a question here from Sandra in Smithers, and it is a follow-up question to the one that we just heard. So thanks, Sandra. And the question is, do you think that providing more information to the public about non-personally identifiable contact tracing locations and estimates of the true untested COVID numbers would help with Northerners that are not taking this seriously?
Sure. Yeah. Thanks. That's a very good question. I would say that, you know, by and large, and it's, I think the proof is sort of in the pudding in terms of our numbers in the north, that people are taking this seriously, and we have done collectively a really good job around flattening the curve. And I would suggest that, you know, we should really look to that, and as opposed to focusing on where people may either because they're unwilling or potentially unable due to various challenges that they may be facing and barriers in to be able to comply with all of the recommendations in their entirety. So I would say by and large, we've done an excellent job. But it is a great question. And my thinking around that is that the flip side is also true. So so if we were to give numbers for each and every community, including our very small communities, perhaps one argument could be that would make people take this more seriously, for example. But on the flip side, we may have communities where we don't have lab confirmed cases. And again, that's only lab confirmed cases. That doesn't mean all cases, because we only know about those who we have test results for. And could that potentially actually make people more laissez-faire about the situation in their own community? Whereas, you know, the advice would be, in fact, just because there's lab confirmed cases or not, we really all do need to be taking the same measures and assuming that it is present anywhere in our communities and plan accordingly. So hopefully that helps.
Okay, well, I'm going to thank Vicky from Prince George, who sent in this question, and she would like to know if we would please share with everyone the presumptive positive, the not tested presumptive positive cases in Northern Health. And then Angela from Quesnel had something similar and said, why has BC chosen not to share presumptive COVID-19 positive cases when we do our reporting? Doesn't this mislead residents when comparing other provinces within Canada with BC?
Yeah, thanks. I'll try to answer that as best as I can, as best as I understand the question. And apologies, I can certainly follow up afterwards if this doesn't suit the need. I think the question was about presumptive cases. So if my understanding of the terminology presumptive cases, and there's a lot of jargon and terminology in all of this. So please understand that I'm going with what I understand the terminology to mean. And in my world, we've used the term presumptive with lab confirmed cases that are technically lab confirmed, but as we operationalize new technology in new labs that didn't have the technology to test COVID previously, there's a validation process that occurs for laboratory cases. So I can't give you the exact numbers, but you need to basically prove that the technology that you're using is being used appropriately and is providing accurate results. And so there's a second vetting of test results at the central provincial laboratory, which is sort of the source of truth, until you yourself become an accredited lab to do the test yourself. So there's a period of time where people may be tested at laboratories who are in the process of being accredited or validated, however you want to say it. And when those results come back, they're initially resulted as a presumptive positive. And then they are sent down to the provincial laboratory at BC CDC to be ultimately confirmed. And then we can report it as a confirmed positive. So in the north, and Cathy, please correct me if I'm wrong, I don't know that we've actually started to operationalize or validate the new technology that we've acquired in the north yet. So, but there will be a period of time where we will have what are called presumptive cases. And I think in the interest of providing accurate data, and as Cathy mentioned, the turnaround time has improved significantly. So it really wouldn't be that big of a lag period between, say, getting a presumptive positive while we validate our technology in Prince George and having that ultimately confirmed positive by the BC Centre for Disease Control. Anything to add?
Yeah, thanks, Raina. I was just going to say, did you want to, do you have anything to add on that one, Cathy, before we go on to the next question?
I just, in terms of the lab equipment at UHNBC, we did go through the validation of that equipment over the course of this last week. And I believe that over the last day or two, we are actually able to perform testing at that site. The only thing I might add to this is sometimes when people are talking about presumptive cases, I think Raina's given you the official definition of what a presumptive case is. Sometimes I think people are referring maybe to cases that are clinically diagnosed, or people have the clinical symptoms, but they haven't had a lab test as yet. Yeah. And in BC, we haven't been counting those cases as part of the case count. But based on the modeling work that Dr. Bonnie Henry and the team at BC-CDC and the Provincial Health Services Authority have done, we've been able to still extrapolate what our situation is in BC in terms of hospitalizations, in terms of unfortunately deaths from the COVID, and how many people are in critical care. And from that, we can have a pretty good understanding of what the situation is in BC. Certainly as our testing capacity has increased in the province, and as the testing guidelines are shifting and changing, I think we'll have an even more comprehensive understanding of the situation on a go-forward basis in the province.
Thank you.
Thanks, Cathy. So this next question is from Crystal from Terrace. So thanks, Crystal. And it's on the topic of numbers, the topic we've been discussing in the last couple of minutes. I believe Dr. Henry announced today we had, there's still 40 positive tests in Northern Health Region confirmed. But her question is, our COVID numbers are substantially lower than other areas in the province. Is there any way this will have a bearing on how we transition back to normal life?
Thanks. I can start, and then Cathy, please add to what I say. In terms of numbers, certainly, as mentioned, we are a vast region with many communities. But in terms of our actual population numbers, those are lower than sort of other health authorities within British Columbia. And so proportionately speaking, we've had less tests appropriately because we have less people. And also when the cases started arriving in BC, they were much more, as you'll recall, related to international travel and much more focused in the Lower Mainland. And there was restricted testing criteria at that time. So a lot more people appropriately were tested, and those people were from the Lower Mainland health authorities. But at this point in time, we've tested in the north people with addresses and who live here in the north. There's been 2,687 tests done on people who live in the north. And as mentioned, we have 40 positive tests. So in terms of the numbers of people being tested in the north, it's fairly proportional, and with the caveat of as I explained, the initial sort of testing mandates and the priority populations at the beginning. I think we're on par with other health authorities in terms of testing and proportionate to the numbers in our health authority. And as we continue to expand testing, I think we will stay in that in proportionate numbers to the other health authorities to ensure that we also have an accurate reflection on what the situation is here and in our communities. And we've been working really hard over the last week to implement strategies to help expand the testing within the north, and appreciating all the various logistical challenges that everyone who's from the north and is listening tonight can appreciate with the breadth and scope and the remoteness of some of our communities.
Well, with that, people are also wondering about the rules and guidelines around social physical distancing. People have done an amazing job in the north. Watch it play out in our grocery stores that are still open, in restaurants that are trying to stay open. Many folks, they're just trying to do the right thing to flatten the curve. But Christy in Prince Rupert, thank you, Christy, asked the question. She says, I see many people starting to have friends over now in their backyards with the weather getting nicer for visits. They're not sitting right next to each other. However, it's not necessarily following the social distancing rules, maybe. I'm under the impression that I only do things with members of my own household. So what advice do we give now with nicer weather and people are trying to, I think they're craving that camaraderie again with their friends and neighbors.
Yeah, absolutely. And I totally appreciate that as well. And I think there are a lot of important benefits to being outside and to social interaction. You know, we are social creatures, and it's been a long winter, and it is starting to get nice out, and being outside is very good, both from a physical and a mental health perspective. So there's been no sort of orders provincially around the social distancing measures. I think we've been very careful about ensuring that we don't want to open any floodgates. We want to ensure people are doing the best that they can to adhere to the recommendations, which has basically resulted in a successful flattening of the curve that I think you should all be very proud of. Physical distancing is limiting close contact with other people to slow the spread of infectious disease. An example of physical distancing is exactly as was stated. So staying 2 meters or 6 feet at length apart from each other, that's about the size of a queen size bed. That enables us to not, in terms of how this disease is most commonly spread through droplets by sneezing, coughing, etc. That amount of distance is proven to be one of the most effective ways to reduce the spread of illness during an outbreak. So even though we're not sick, we may need to change our everyday routines in this way to stop the germs between people. I think people are, and I've witnessed this as well, and it's been really impressive. And people, I think, by and large, are being very careful, very responsible. There's a lot of ways to maintain physical distancing. The 2 meters apart, staying home as much as possible, recognizing that we also do need to get outside and take a breath of fresh air and ensure we're maintaining our physical and mental health, using virtual technology to keep in touch with friends and family, and including virtual play dates for your kids, which I've had to do as well. So yeah, I'm not sure, Cathy, if you have anything to add to that.
No, that's a really good answer, Raina. Thank you.
Thanks, Raina. And I like the analogy of a queen size bed for the safe distancing. I've seen a few other ones up in the Northwest here. The length of 2 good sized spring salmon put tip to tail, or even more, I guess, widespread across the north if you think of the length of a moose between 2 people. So anyway, the point is keep up that safe distancing. And this next question is looking for some more clarity on that. It's an interesting question. It's Joe from Prince George. So thanks, Joe. And he asks, why does Northern Health go against both federal and BC government by saying it is safe to go for a drive rather than the order to stay home?
Sure, thanks. I would challenge that concept that Northern Health is going against federal and BC government. I think it's and appreciating that it can be confusing sometimes to understand, what's an order and what's enforceable versus what's a recommendation, and the spectrum in between. It's not always obvious, and it's not always clear, but in fact, there's been no provincial or federal orders to everyone to stay at home at all times. There's been no order to sort of be on lockdown in your home for weeks and months on end. So the measures that there are orders in place, and those can all be found on the government website. And then there's also recommendations, which are population level recommendations around social distancing, around respiratory cough etiquette, around hand washing, and the expectation is never that there's going to be 100% compliance around this. People need to get out. They need to also do essential errands. They need to buy groceries. So there's certainly not an expectation that people are shut into their homes 100% of the time. There's an expectation that people within the constraints of their own scenario, do the very best that they can. And I think that is by and large what we are seeing. So I think we're actually in alignment with both the federal and BC government in what we're doing here and promoting in Northern Health.
Yeah, I think what I might just add to that is I think people need to think carefully about what they do in their normal daily activities. How does it align with some of the things that Dr. Henry has talked to us all about in terms of avoiding mass gatherings, and not having mass gatherings, the social distancing, the things that Raina's talked about. And maybe one of the questions people need to ask themselves when they're going for a drive, what is it that they're doing when they're going for a drive? Who's in the vehicle with them? What kinds of things might they be expecting to do on that drive? And making sure that they're in alignment with the direction that's been provided to all of us, because that direction is making a huge difference for both the healthcare system and for the health and well-being of our population.
Good, thanks. Well, I have another question from somebody in Dawson Creek, and Doug, you can laugh that we said some of these are a lot Dawson Creek area coming in, but the question is, businesses and physician offices are allowing 1 to 2 people in at a time while others wait in their vehicle to come in for the appointment. So what exactly are the guidelines regarding health clinics, and has there been messaging regarding the process? I wonder who can answer that one.
I can start, and then it's certainly, this is very consistent with some of the other messaging that Raina has already described for you. I think one of the most important things is that if people need to see their family physician or nurse practitioner or specialist, they should make sure that they do that. Many of the nurse practitioners and primary care offices and specialist offices are providing virtual options, either telephone or video kinds of connectivity for their patients. And it is important that people continue to access the healthcare that they need. So I just say that as kind of something at the outset. But certainly within the environment of a primary care clinic or any other kind of health clinic, the same rules apply in terms of making sure that the way that the services are organized allow for physical distancing, ensure that if physical distancing isn't possible or somebody's coming in with respiratory symptoms, that a mask is provided, that hand washing, coughing etiquette, all of those kinds of things are in place, and that the appropriate environmental cleaning opportunities are there as well. And Raina probably has some things she might want to add to that.
Yeah, no, thanks, Cathy. You did an excellent job summarizing that. I would just also echo the importance of, I think physicians' offices and businesses have been doing an excellent job overall in being able to, where possible, make things work, and by using with using the help of the guidelines for medical visits. There are certain things that can be done virtually, and I think the virtual options that have been set up have been very impressive and extensive across the north and across the province. As you can well imagine, there are certain scenarios where a virtual visit just isn't sufficient in order to appropriately assess and manage a specific patient scenario. And for example, if you need to listen to their heart or you need to listen to their lungs, that can be very challenging to do virtually. And so people who do need to go in and see their medical practitioner or nurse practitioner, it's very important in certain scenarios that they actually do so. And so I think offices have done a great job at being able to balance the virtual clinics with the in-person visits, and while keeping everything safe.
Thanks to each of you for those answers and that information. Here's a question from Chris from Kitimat, and it was actually asked today as well by a reporter to Dr. Henry during the news conference, and I know it relates to some of the other jurisdictions in the world that are seeing some of this, whether COVID coming back or the testing and what actually constitutes a COVID-free test. So the question is, please advise the criteria in determining a positive COVID-19 patient has recovered and has been added to the recovered tally, i.e. is it just lapsed duration or a combination of lapsed time as well as symptom-free for a specific duration, or is there another test performed to confirm a positive or negative result?
Yeah, no, that's a great question. And I would say, there's, I think all of the suggested answers are correct in that and I would say it depends. For the vast majority of times, the cases are quite straightforward. They're mild cases. They're cases where they can self-isolate at home, not requiring acute care. They, for those situations, people generally will recover and become asymptomatic from their illness from 10 days after the start of their first symptoms. So provided someone has a mild course of their illness, that say they test positive, they are able to recover from their illness at home, and 10 days have passed, they're feeling well, they're no longer febrile, then those would kind of be taken off the list of, say, being active to an inactive case. So they'll still be counted in the cumulative tallies that we do, but they will be removed as being sort of someone that we are actively following from a public health perspective, because they're well and they're no longer contagious. There's a few scenarios where it's a little bit more complicated, and so it involves a spectrum of things that we assess, and ultimately the medical health officer, in conjunction with the clinical team, based on a variety of variables, including how severe their symptoms were, etc. We counted and how long they've been resolved of all of their symptoms, including their fever. When they first tested positive, there's a variety of pieces that go into a decision as to whether or not the medical health officer will decide that someone is now can be removed from the active list and can now become considered an inactive case. And those are taken on a case-by-case basis, and those would be for the more complicated case. But absolutely correct, for the vast majority of the time, it's 10 days from the onset of symptoms. We follow them up during the 10 days, and they resolve, and then they're removed from the active list.
Well, thanks. I've got one more question, and then we're going to be going. I know people have started to ask questions on Facebook, and we're going to make sure we get to some of the live questions here. But I have one more here from Linda in Vanderhoof. So thanks, Linda. And it's actually around, if somebody is tested positive, unfortunately, and how prepared are we? So which hospitals are prepared to take our COVID patients, and what is the plan for the small communities? And Diane in Fort St. John, along kind of the same lines, says, are we looking at maybe taking Quebec's lead to possibly deploy medical military personnel to help in these hospitals like Fort St. John?
So maybe I'll start on this one, and Raina can add in. Across the province, we have identified 19 hospitals that have the critical care capacity to be able to support the critical care, acute care, critical care needs for people who are more severely ill. And in the north, those hospitals are Fort St. John, Terrace, and Prince George at UHNBC. Those are the part of that 19 hospital number in the province. However, all of our hospitals have done a tremendous amount of work to make sure that they're prepared for people who might come to their emergency departments with respiratory symptoms or COVID-like symptoms. and to provide care for a patient who might need that care until they can be transported, if they need to be transported to a higher level of care, to one of those 3 hospitals in northern BC. In terms of the question around the military piece, I think whenever you're planning in an emergency situation like this for the pandemic, there's a number of phases in that pandemic planning process. And we've been led through that very effectively by the minister and Dr. Bonnie Henry and the ministry as we've worked together as health authorities across the province. We have done a lot of work to decrease the occupancy in our hospitals so that we do have capacity to provide care for people both in acute care beds as well as in the critical care area. Right now in the north, where our hospitals are running somewhere between 65 and 68% capacity. So we do have that capacity currently to be able to support people with COVID-like symptoms. We've also prepared very carefully inside our hospitals for people who might present to make sure that as we provide care for them, that the rest of the patients in the hospital are kept safe so that people can continue to receive the care that they might need in our hospital environments. In terms of the military piece, I think always in the background, we have if we were to be at a situation that surges beyond what we're capable of managing, then what are the options that we would put in place? And you saw that in Vancouver when Vancouver situated a field hospital at the convention center. And those kinds of things we work on provincially together to make sure that we've got those kind of options able to be mobilized if we were ever in that situation. I'll just add that thankfully in British Columbia, we're not seeing that. We are seeing a bending of the curve. And again, I think we're all very grateful for everything everybody's been doing to enable that bending of the curve to occur. Because I don't think it would be a nice place for the health system or for our society to be confronted with that kind of surge.
Thanks for that, Cathy. And yeah, thanks for everybody for doing your part to bend the curve. That wraps up the submitted questions part. And thanks to everybody who took the time to submit questions. We're going to go to the live questions now, and I'll just check my live feed. It's a question from Vicky, and she asks, what ratio of people in certain population would be considered an outbreak?
Yeah, that's a very good question. And for COVID-19, this is actually a novel virus. This is new to human beings. It's the first time this virus has ever been exposed to human beings. So we actually are learning about this virus every day. And often there are different definitions of an outbreak. One of the common definitions is that we're seeing a number of people who are infected with the disease above which would be the expected rate. For COVID-19, we don't have that. This isn't measles or mumps or rubella, where we have decades worth of data to help us understand what those numbers are. So for the purposes of COVID-19, we've basically, in terms of when we describe an outbreak and using the term outbreak, we've been in British Columbia using that term very specifically and with intention. And we've been using that term to describe scenarios in closed type of settings. So we would use an outbreak terminology, for example, in the long-term care setting, where we've actually been very conservative in what we're calling an outbreak, which is one case of a resident in our long-term care facility. Usually you would need to have at least a couple or a few cases that are linked to one another before we call something an outbreak. But because of how novel this is and how important it is for the what we know is a very vulnerable population, like long-term care residents, we're using a very conservative number in those scenarios. Other settings where we would be looking to see whether or not there is spread occurring beyond which we're not able to necessarily trace all the cases and determine how things have been spread from person to person would be places like correctional centers, so shelters, for example. Correctional centers, so looking at the local epidemiology and the local situation in closed settings is where we are basically assessing the situation on a case-by-case basis and deciding whether or not we would be deciding that, yes, this is an outbreak. And really the term is helpful in that closed setting, because we can then implement evidence-based infection control practices that have been known to be effective in settings such as a long-term care facility. So we enhance everything. We enhance the cleaning measures. We enhance our testing. We enhance all of those things to help us actually contain and control an outbreak in a community where there aren't four walls around it, for example. It's a bit of a different scenario, and with COVID-19, it's a novel virus. Everyone is susceptible unless you've already been infected at this point in time. And so at a community level, we are not declaring community outbreaks per se. These are not contained closed settings where we can control things as we can in, say, a hospital or an acute care setting. But we would certainly expect that there are scenarios where we have community level spread or community wide spread, which is when we have virus circulating in the community. Broadly speaking, we can't always, attach this person to that person and connect the dots as to how and when someone may have acquired the virus. When it comes to particularly vulnerable communities such as those, and we have in the north, very isolated and remote communities that may be quite a distance from, say, a healthcare facility. Again, we don't need to use the term outbreak to know that if we have cases in these communities, that obviously it requires a very aggressive and robust and quick response. A long-winded way of saying that the terminology for COVID-19 is as in BC as I've articulated, and it really does kind of depend on the actual communicable disease that you're talking about when you talk about what constitutes an outbreak. So hopefully that helps describe at least where we're at right now in BC with COVID-19.
Okay, well, thanks. I have another question here that came in from Candy Gibson, probably an easy one to answer, maybe Cathy, I'm sure. Does Northern Health region have enough PPE?
So right now, yes, Northern Health does have enough PPE. I think the PPE situation, if you watch the news, from across Canada and internationally, PPE is a very vulnerable supply chain, and it's something that we are monitoring and worrying about on a moment-by-moment basis. In BC, there is a provincial supply chain for the health authorities that's led out by the Provincial Health Services Authority. We also have a number of provincial working groups that Northern Health is actively involved in to work together on securing supply, making sure that the supply is the right supply and it is appropriate for the healthcare setting, and that supply is allocated across the province effectively and according to the need in each of the facilities across the region. The other thing that I think BC has done very well is looked at the best practice evidence and analyzed the PPE, the personal protective equipment that is most appropriate in the various settings, and has laid out a set of guidelines that we are implementing in all of the health authorities consistently across the province. So it is an area of vulnerability. It is one that we watch very carefully. And it's one that there are people in all of the health authorities spending 100% of their time focused on making sure that we have PPE available, and that we know what the alternatives are should we ever be in the situation where we need to substitute out, and that is appropriate, safe alternative to be using in the healthcare setting.
Thanks, Cathy. just another acronym that I've finally figured out what it means as we got into this pandemic. PPE, protective personal equipment, right? But it was something that I wasn't familiar with that acronym before. We've got another live question from Lee, and we know that we hear from Dr. Bonnie Henry about overall in BC the number of recovered cases, and she's very strongly points that out in the news conferences each day. But Lee asks something more specific: 40 positive cases in total in the Northern Health area, but how many of these are now recovered?
Yeah, that's a great question. And I believe as of today, of the 40, I could be off by a number or two, but I believe we're actually at 32 of the 40 recovered today. So 8 cases considered active.
Correct.
Cathy's nodding, so I must be right.
Okay, well, I have another question here too, is how many people are being tested daily in Northern Health? And that's a question coming in from Angela.
I'm not sure I can answer that question precisely. I know that the total number that we have tested, as was identified earlier, is about 2,700 tests. And I also know that the number of tests being completed is increasing. I hesitate to say a number because it might not be accurate. But you know, that information is posted on the BC CDC website, the number of tests that are performed in the province. So I think it is available, and we could certainly get that information.
Thanks to both of you for that. We've got another live question. This is like the snapper round or something. It's from Brandy, and Brandy asks, is there talk around easing of restrictions around visitation at our local hospitals?
So I'll start on this question. This is a really difficult thing for people, and I just want to really acknowledge how hard it is to have a loved one in a hospital or long-term care environment, and have both for the patient or the resident in a long-term care facility, have that visiting, have those visitors restricted, and then also for people in the community who want to visit in the hospital or long-term care environment, or assisted living environment, and be restricted in being able to go into those facilities as we used to be able to do. The reason for it, though, is to both protect the people within the hospital environment from and decrease the traffic in the hospital environment, because that's a vulnerable population, as is the long-term care environment. So we do need to decrease the exposure, and the one way to do that is to decrease the number of people who are coming in and out of our facilities. And then secondly, whenever you're dealing with this kind of crisis, you need to have much more control of who's coming in and out of our facilities. Again, I just want to acknowledge how hard that is for people. Right now, we are not planning to change that. That will be in place. This was part of a directive that did come from the Ministry of Health, and I believe there in the long-term care environment was part of an order as well. And Raina can correct me if I'm wrong about that, but we won't be changing that until provincially there's some decisions made that would be an appropriate thing to do. And again, it really is about protecting a very vulnerable population.
Okay, so we're just going to be looking at the time here, starting to wrap up. We have a few final comments I think we're going to bring. I'm glad we were able to educate Doug on what PPE was. You know, a lot of people are asking about the PPE, and so when we'll probably end off maybe with a a question that I have that I know has been really coming into me a lot through my office. And I want to thank, I know Doug as well, and all the MLAs across the Northern Health region have been doing their very best being open to the constituents. I know I talk to all my colleagues all the time who seem to be busy day and night trying to do the best they can, gathering information to help answer these questions for people. But one of the ones that's coming in quite a bit right now is after what's happened in Fort McMurray with some of the positive cases that happened there in the oil and gas sector. And as everyone knows, the oil and gas sector is still slow, but it's still active up in the Peace region. And there's a lot of people from all across BC that fly back and forth from BC to Alberta. And of course, with these new positive cases in Alberta being disclosed, it has people worried for that sector. So what is Northern Health doing or planning to do to put some extra measures in place maybe to help these people? Now, whether it's forestry, mining, oil and gas, we have people traveling back and forth all the time between provinces for work.
Sure. Yeah, I can start, and then Cathy can probably add to what I can say. What I would say to that is we've been very engaged with local industry. As you know, in the north, we have a lot of industry at various different sectors. Industry across the north has scaled back their activities significantly in light of the COVID pandemic. The decision as to which activities can continue, which activities are deemed essential services, etc., have all been described and decided upon by the provincial health officer. So the industrial activities, industrial camps have been allowed to continue to operate with the caveat that they operate safely. And to that end, and Northern Health has been actually instrumental in developing the foundations of the provincial guidance document for industrial camps during this pandemic. And it clearly outlines the expectations around infection control, around screening, policy, implementing appropriate administrative policies, environmental cleaning policies, ensuring that, for example, the sanitation and the social distancing is maintained, for example, in the food service sort of areas where people may be congregating and eating, the camp accommodations themselves for sleeping in individual bathrooms, ensuring people can self-isolate if they become symptomatic. We're now working very closely on trying to establish a testing strategy for industrial camps across the north. So a lot of very focused effort has gone into trying to ensure that where camps are operational, that they are operating in the safest way possible. And we've been providing support to them in being able to do that. So recognizing that this is not a zero risk situation, nor is anything, but we've, from Northern Health perspective, we've been very engaged. And as you've mentioned, I've been very impressed with a lot of the efforts that various stakeholders have taken to implement those guidances, and very strictly so. So that's been, yeah, very encouraging. And also just recognizing, I know there's concern around interprovincial travel for a variety of reasons. And to date, you know, Dr. Henry has not instituted any restrictions on interprovincial travel or quarantine orders, such as is being done, for example, for international visitors to the province. And so, you know, there's essential work that needs to happen across our borders. And I think it's always helpful to remind ourselves that the goal of all of the public measures that have been put into place is not to stop COVID-19 from coming to the north or to any of our communities. That's stopping that is an impossibility. What we're trying to do is to ensure we slow the spread, so put in the appropriate mitigation strategies so that we don't overwhelm our healthcare system. And I think to date, we've been doing that very effectively. So it's a balance between the measures and potential unintended consequences. So Cathy, do you have anything to add?
No, I thought that was a very comprehensive answer. Well done, Raina.
Guess we'll turn it over to you, Doug. Oh. Did we lose Doug? Is he frozen out?
Thank you for that. Yeah, there we go.
Yeah.
Thanks, Mike.
Rural technology. So it looks like we've Doug's frozen out here a little bit. So
That's right. I'm getting some. You might. Yeah. How's it going now? Do you want to jump in, Mike?
well, we can. Yeah, maybe I'll jump in right now then, Doug, and interrupt when you get your signal back. But you know, this is normal for so many people in rural British Columbia, places that don't even have internet, and places where Doug, you know, can be sporadic. But really want to thank Cathy Ulrich and Dr. Fumerton for being with us tonight, answering questions. And I know we didn't get to every single question. There was literally hundreds and hundreds of them that were mailed in or sent in to us for tonight. And hopefully we were able to answer at least some of those and get them out to you. I think the big point to end though too is reminding for seniors looking for additional support to make sure they call 211 or visit www.bc211.ca. If you or a family member need any additional medical advice, this number is known to everyone now. We've been doing a good job getting it out there. Call 811. It's amazing the information that's there. The latest medical updates, as was mentioned earlier tonight too, you can visit www.bccdc.ca, and that gives us the case counts, prevention, tests that are taking place, and the risks too. And how about Doug? Are you there?
Yeah, I think so. How's it sounding now?
I can hear you. I don't want to steal all your thunder.
Amazing that we were able to keep it together for over an hour technology wise. And so, yeah, I did you just finish off on the BCCDC website, Mike?
Yes.
Yeah, so important to know about the provincial health officers' orders, notices, and guidance. And you can visit gov.bc.ca/PHO guidance for that. For non-health related information, including financial, childcare, education, travel, transportation, and essential service information, that's an awful lot of stuff. Go to govbc.ca/COVID-19 or call 1-888-COVID-19. And if you don't have numbers on your phone, that would be 1-888-268-4319 between 7:30 a.m. and 8 p.m. 7 days a week. I'll turn it back over to you for the last couple, Mike.
Okay. Well, again, just thank you. Thank you to everybody who tuned in tonight again, and thanks to all my MLA colleagues and Doug's who have been doing everything they can to spread the word as best as possible about stay at home if you're sick. Wash your hands frequently for at least 20 seconds. Cover your cough, sneeze into your elbow. One thing we learned tonight about social distancing from Doug is stay at least one adult moose away from each other. Don't forget though, even though you're staying apart, I think for mental well-being too, we need to find ways to stay connected. Social media has been great. I do my Wilson impersonation talking over the fence with my neighbor. and there's still opportunities. Get out, go for a walk, and do that social distancing. I know we do have one more virtual town hall next week, so if you have family and friends in different parts of the province, let them know. For more information, to visit www.gov.bc.ca/COVID-19 town halls. And I'll just end by again thanking Doug, his colleagues. Government's been working very hard trying to get the information out. We've been working very collegially between all three parties to make sure that we work together to do our best to flatten the curve, keep our citizens of BC safe. And with that, I want to thank everyone for tuning in, thank our guests, and have everybody have a great evening, a great spring and summer, and we will all be talking soon. And as Dr. Henry says, be kind.
Thanks, Mike. And I'll just add that bend the curve, not the rules. Now is not the time to let our guard down. Together, we'll be able to defeat COVID-19 again by working together, and that's the Northern rural way. So thank you everybody for tuning in. Thanks Mike, thanks Cathy, thanks Dr. Fumerton, and stay safe, be kind.
Thank you.
Yeah, thank you.
Thanks everyone.